Hi, my name is Alex Sandhu. I'm a cardiologist at Stanford University and a health services researcher. So I split my time between clinical cardiology, where I see patients with kind of the entire spectrum of heart disease, and doing population health research, as you say, where I'm really passionate about trying to find and implement ways that we can improve quality of care and improve kind of the overall heart population health. We know that heart artery disease is the #1 killer across the United States. We have really effective treatments for preventing heart artery disease, such as statin therapy. But the vast majority of people that are at high risk for heart artery disease aren't on these preventive treatments. Probably the best marker of increased risk is something called coronary artery calcium, or CAC. So our prior collaboration was building an algorithm that can actually identify and quantify the amount of coronary artery calcium on a chest CT done for any reason. Aortic stenosis is a chronic disease that affects millions of people around the world. It involves narrowing of the valve that your heart pumps out blood from to the rest of the body. Aortic stenosis is a life-threatening disease that, if left untreated, leads to progressive damage on the heart, the development of heart failure, and can lead to death. We're really fortunate that we have effective treatments for aortic stenosis when it gets severe, and those treatments can either be surgery to replace the valve or a procedure where we replace the valve without open surgery called a TAVR, or transcatheter aortic valve replacement. Unfortunately, most people with aortic stenosis don't get recognized and treated until quite late in their disease, after the condition's already caused damage to the heart. One really interesting finding is that when the aortic valve gets really narrowed, it also gets very calcified. And we can see that calcium, the aortic valve calcium, on chest CTs. Aortic valve calcium is often not measured because it's not the reason that the scan was ordered. The radiologist and the ordering clinician are trying to answer some other question on these standard chest CTs, so they're not necessarily focused on looking for aortic valve calcium. But similar to coronary calcium, if we have these millions of chest CTs, and many of those will include patients that already have aortic valve calcium, if we could systematically identify that, quantify it, we could find a lot of patients that have aortic stenosis that hasn't yet been recognized and potentially get them earlier screening, earlier diagnosis, and earlier treatment. It's a really exciting time for us to be able to identify aortic valve calcium across the population. We now have access to aortic valve treatments that far outstrips where we were 30 years ago with the arrival of TAVR. It's very exciting that we have these ongoing trials to help us better understand how we should monitor and treat earlier disease, whether that's patients before they develop symptoms, like in the early TAVR trial, or it's patients with moderate aortic stenosis, like the ongoing PROGRESS trial. One challenge with this line of research and these ongoing trials is the difficulty of identifying patients before they develop severe symptoms and have identified aortic stenosis. So as the paradigm changes to where we might start treating more patients that don't yet have symptoms, for example, something like aortic valve calcium, which can identify patients who are developing and might have moderate or asymptomatic severe aortic stenosis, is going to be really important for identifying these patients to get them treatments earlier.